Welcome to our new episode of Bridging Insider. Today we have Lisa as our guest. Lisa had a new surgery. What'd you have?
I had knee replacement surgery on May 28th.
So she's 6 weeks and
1 day.
Okay. Knee replacement has been a really popular topic on the channel, so I was thrilled that Lisa was able to come in so soon after her surgery. Your rehab is going
Very well.
Okay, and what are you still limited with?
I'm limited with physical, like sports activities. I can't walk all that far yet. And
well, with your knee, are you able to flex and extend the whole way?
I have almost full extension, and I have about 125 flexion, and I think they want me to be about 130, but I think normal is maybe 140. I'm not sure.
Yeah, it seems like different orthos have different expectations. And then what's still bothering you with your leg?
So my leg, the bone actually is very, very sore. And then I get sore on the sides, like right here, even to the touch is still sore, and sometimes behind, depending on what exercise I've been doing.
It looks really good.
Yeah, I'm very
lucky. Part
lucky.
of the scar is from a prior surgery, but yeah, it's healed very well.
Yeah, no, I'm very lucky. I do a lot of icing and kind of follow doctor's orders.
Okay.
I rehab.
So those of you who don't know me, that you're new to the channel, I'm Kara Lindell. I'm the founder of the Bridging Institute and the Bridging Technique. And what we do is take a little different spin on how the muscles are working together, how the micro movements are flowing. So when we have something that disrupts that, such as a surgery, we want to match up and guide the muscles back into working together again and reset them so that they're back to more of how they used to be. So what we're going to do with Lisa is just check in a little bit with what I can passively get her knee to do. And we'll do that sitting and laying down. And she also mentioned earlier that her back is a little tired and sore. So we'll have her lay down and we'll check how her legs are working with her back as well. One other thing she noticed is that for all the time that her knee was bothering her before the surgery, as her foot has shifted, she favored the outside edge. So maybe we'll have a minute to just see what's going on with the foot, or
I would appreciate it.
We might have to have her come back again. But so let's get down to it. So we're going to I'm gonna just let me lift because I saw you and you can do pretty well. This is where I can easily lift, but compared to this one, it straightens very easily. So we want that ease of that transition to be better. And believe it or not, there's a little bit of turning that should be happening with the knee, so that as we pivot with our feet, that shifts up the leg and triggers our hamstrings and our quads to switch on. So we're also going to check. In fact, let's just do it now. Let's see what happens when we bend your foot. Does this patellar tendon activate, and then that interacts with your quads? Okay. Often this is one that I find needs a little support and guidance after the knee surgeries. So, okay, let me do it. Yeah, see, you can get it to move, but I can't. If we, again, check, because it's always nice to know what should it be. So let's look at this one. And I'm going to change the angle so it's a little easier to see. But it's funny. Let's see if I can feel it. It's a sliding sort of motion. Often you can see it. I'm not seeing it so easily. I can feel. Do you feel your quad? Because I can see your quad fire. So let's see on this one. We're going to switch around. You do have some atrophy in your calf from everything being off of it. So, okay, so I do not see your quads firing up.
No, not at all.
No, so let's kind of look at that as one of the first things we do. We're going to just match up motion from the ankle to right below the knee where that patellar tendon is. During the knee replacement surgery, they just move it off to the side and then put it back. So it's what anchors the kneecap, because they put the kneecap back.
Right.
And then what that is connected to is actually your quads. So it comes across. So we're going to just kind of give a little support down at the ankle using my fun peanut balls and just see if we can get some overall motion. You know, it feels really stiff, and that's where you're talking about it just feels odd. So I'm going to go sideways and kind of closer to where they did because they literally pound a metal rod into your bone. Right. So let's just kind of give that some support where they did that. Because who knows how good at carpenters they were.
Hopefully very good.
Yes. It's kind of funny if you see the tools that the ortho surgeons use. Hammers, saws.
Definitely don't want to know that.
Yeah. So it feels a little more wiggly there. And then let's go down a little bit. Okay, when I go down another step, it feels really stiff. So maybe her bone just didn't know what to do with the new part. There. It's really awesome that there's not much swelling. Did you have a lot at first, or?
At first I did, but I've been using the ice machine very religiously.
Okay. Did your foot swell?
I don't remember. Maybe a little bit, not horribly.
I know other people I've seen, the foot ankle swelling has actually been really bothersome. So there we go. So we're just kind of matching up the freedom of all these muscles that have been impacted. Because on the sides, they need to work together too, not just the front and the back. Okay, so now I've got more your knee and then down to your calf. So let's see if we can get that so it feels like it all works together. Okay. And what's interesting with what I'm trying to roll from my right hand to my left, your hip actually feels a little stuck.
Oh, yeah.
So let's just kind of go back and forth a little bit more. And your hip gets impacted too because the bone above the knee has some work done with it as well. I think it's good that none of us know exactly what happens.
I don't want to know exactly what happens. I watched the animated videos and that was enough.
Yeah. Oh, there. You can just see how that's wiggling around more. And there's the freedom of motion at the hip. So let's see if that's enough to get your quads. Almost. Oh, there they are. Do you feel it? I mean, I can see it. But...
Yeah, I can see it too.
Oh, and actually I can see, I'm not sure if the lighting is good, but I can see part of the patellar tendon actually like tense up. I'm just going to wiggle right in this area. Where was the bottom? Was this the bottom of the incision?
Yes.
Okay, so I'm just going to use a couple fingers and just lightly, there's not a lot of movement there. It's almost like it's hot glued down. So let's just see if we can get that moving again. Because that upper layer, even though it's not muscle, it'll inhibit the muscle from moving because the muscle's right underneath there and the tendon. So this is a nice example to see because it's healed enough that the bandages aren't there still. One of our other videos, the gentleman still had the bandages on, so we weren't able to see exactly what was going on at his knee. Oh, wow.
Yeah, that's good.
Yeah, and now there's some movement in here. Okay, let's check one more time. Oh. Okay, that's a little bit more pronounced, which is good. Okay, before I have her lay down to just check overall, I'm going to come from behind because one of the things also that a coordination that seems to be common with knee replacements that's hard to reestablish on its own is from the back of the knee to the front. And your hamstrings, which are underneath your quads, they end right down here. So they got disrupted.
Yeah.
So I'm going to support from behind right where her hamstrings are ending. But I'm also going to come down on the front where the hamstrings actually attach. And I'm just going to hold and just bounce a little bit. And we should feel that they sort of soften and melt. And it's more the one on the outside edge that seems a little stiff. It'll just get a little bouncier. It's almost. So I'm going back and forth, just wiggling back and forth, and then up and down, just a little of this and a little of that. There. That's bouncier. So that makes it easier from a strength standpoint for your quads and your hamstrings to coordinate and switch on, switch off with each other. So that looks pretty good. Because those two coordinations that we find between the ankle and the patellar tendon and then the front and back of the knee are kind of the two most common. That it's a finesse, but it's an important finesse. So lay down and have you put your head over there. Let's just see what is going on with how your legs are. Okay, just lifting. So those seem pretty similar. That seems, actually the left one seems better than the right. Oh, no. Let's give this one a little tune up. Been doing all that extra work.
Exactly.
Okay. I want to see another transition with your knee. I'm just going to put a peanut underneath for support. And if it doesn't go, we're not going to force it, because with the healing at 6 weeks, you're very healed, but there's still a little bit left. That's actually not bad. Okay, I'm going to try one more time. This transition, if it wasn't moving, we'd leave it for now, but it's actually the transition that goes into a squat, and that's been part of your exercises, right?
Correct.
Yeah, so because a squat doesn't bend just straight. It has to go off to the side a little bit, and you kind of have it, and I'm going to just support a little bit and see if we can coax it into working, because it's more of a spiral, like part of the inside of the leg and then transitions to the outside of what stabilizes at the knee. And one more time. Oh, there you go. Beautiful. Okay. Don't want to overdo that. Okay. So it's interesting. You're missing a little bit of extension, but it's actually just a tiny bit.
Right.
I'm going to support while we're checking your foot.
Okay.
Because I don't want to stress that too much. So her foot, I just want to see how does motion through the toes interact with the ankle. Turns a lot up and down. There's actually a lot of motion there.
Right.
Maybe a little too much.
I've been working on the motion because it was stuck this way.
Okay, so we're going to go with the way it was stuck, and it's where it's stuck is more up in the top part of the foot. Let's see if we can get that to transition. So the two bones that were affected by the knee, or that connect at the knee, also connect at the ankle. And so if they're stuck at the knee end, they also are limited at the foot end. And at the end of the day, our body is really just a collection of structures, and how well they work limits how well everything else works. There you go. That seems pretty centered. It actually seems looser than this one. So let's give this one a tune up.
That would be good.
And so I'm just going to push on this one. Nice. And this one. Good. These seem pretty equal. Okay. Because of the lower back, what I'm going to do is lift one leg. I'm going to roll toward me. So hopefully you're going to start to roll just from the hip. If you don't, that's just tells us, okay. So it could be a little easier, but it moves.
Okay.
So let's see what happens on this side. And before you had the knee surgery, that hip and low back was actually part of the pain, right?
Right, exactly.
Okay, so I'm going to hold from underneath. And so I'm not forcing anything. It doesn't turn easily, but you do turn. Okay. Does it feel similar to the other side or a little bit?
No, pulls on this side.
Okay, so we're actually going to go back to the other side.
Okay.
And so one of our rules of thumb with bridging is that we follow what moves. And so I'm going to use this one and just kind of rock back and forth a few times. And there we go. Then we're going to come back to her left, and we are going to hope that it moves easier.
Okay.
So it could be just part of the compensations from
Right.
how your knee was bothering you. Okay, it's easier than it was, but the right side is actually still easier. So I'm going to support knee and foot, and we're just going to see if we can have everybody wake up and get their act together and support a little differently. There we go.
Thanks.
Yeah. I suspect some of the hobbling around and just how you favored
Right.
just to get by. Okay, I'm still going to support that. Okay, the last thing I want to check is just globally.
Okay.
Do we match arm and leg? So I'm going to lift at your knee so that your knee is supported.
Okay.
And see if your whole core moves. Yay!
That's good.
And then we're going to leave it supported and come over and check the other side. Yay. That's very similar.
Yeah.
So sit up
Okay.
and swing around. So just a quick recap. It's 6 weeks and 1 day. Post-knee replacement. At least it's doing great. We just wanted to fine-tune some of the relationships. So we picked up 3 that are a finesse, but important for, she wants to be playing tennis again. So it's how the ankle and the knee coordinate with the patellar tendon and how that fires up the quads, how the hamstrings coordinate or connect to the lower part of the knee at the top of the lower leg. And then the third part was when she was laying down and how that spiral kind of motion flows from the foot through the knee to the hip, which is what you need for squats and tennis. So, and working out. So hopefully you found this helpful. Give Lisa a thumbs up. It was great that you were able to make it.
Thanks for having me.
We look forward to your stories about playing tennis. If you would like to be a guest, check in the show notes, let us know. And if you're interested in learning the bridging technique, we'll be offering a new cohort for the course in the fall of 2024. And that information is available on our website. And look forward to having you for another session coming soon.